When people think of depression, they imagine someone crying all day, locked in their room, unable to get out of bed. And yes, that can happen, but in clinical practice, many depressions don't look like that. I see adults who work, who support families, who fulfill responsibilities, but inside they are empty. People who are not necessarily sad, but are not okay either. And that type of depression is dangerous because it goes unnoticed. No one validates it, no one detects it, sometimes not even the person themselves. Depression doesn't always scream, sometimes it whispers for years. From clinical psychology, depression is not weakness, it is not laziness, it is not lack of faith or lack of character. Depression is a mood disorder that simultaneously affects emotion, thought, the body, and motivation. That is why the depressed person does not just feel bad. They think differently, move differently, sleep differently, and perceive themselves differently. Diagnostic manuals such as the DSM describe these patterns, but beyond the criteria, it is important to understand that depression modifies the experience of living. Many adults come to my office and tell me, "Doctor, I'm not sad, but I don't enjoy anything." That has a clinical name, anhedonia. Others say, "I'm tired all the time, everything bothers me, I have no patience, my mind is slow." And many times they believe that this is stress, age, or simply life. But when these symptoms persist over time, we are talking about depression, even if there is no crying. Here I want to introduce you to a concept I have developed over the years, the emotional pendulum theory. Mental health is not about being happy all the time. Mental health is being able to swing between activity and rest, between emotion and calm, between effort and recovery. In depression, the pendulum gets stuck at one end, low energy, emotional rigidity, disconnection. The therapeutic goal is not to push the person to think positive. The goal is to restore movement, flexibility, and regulation. Now let's answer the central question. Is depression curable? The honest answer is depression is treatable, but it doesn't always get cured like an infection. In many cases, depression is regulated, is understood, is transformed, is prevented. The problem is that we live in a culture that seeks quick solutions for processes that are deep. Today, neuroscience shows us that depression is not just in the mind. There are changes in neurotransmitters, inflammation, microbiota, sleep, biological rhythms. That's why treating depression from only one dimension is often not enough. What helps is not just one thing. A combination helps. Psychotherapy, rhythm regulation, progressive movement, breathing, human connection. Depression is recovered step by step, not with brute force. If you are watching this video and felt identified, I want to tell you something important. Depression does not take away your worth. It does not make you weak. It does not define you. It is asking for attention, care, and regulation. In the description, I leave you the link to the Mental Health Institute of Florida, where we work clinically with adults, and also links to my books, where I delve deeper into the theory of the emotional pendulum and its therapeutic application. This video is informational and does not replace an individual clinical assessment.